is caused by different viruses and occurs mainly in the fall, winter, and spring seasons. Many different viruses can cause a cold, and some of these viruses are rhinovirus, coronavirus, and influenza. You may get infected by several colds during the period of 1 year. Viruses do survive on surfaces, and they can survive from a few minutes to several hours. Signs and symptoms of a cold are congestion, sneezing, a runny nose, cough, sore throat. It might be associated with mild fatigue, and rarely there is some fever. A cold may last for a period that can vary between 2 days and 10 days. Colds are transmitted by droplets and contact. So if an infected person coughs on somebody who's not ill, they may transmit from large droplets, or a cold may be transmitted by contact, that is via contaminated hands, so hands that have been in contact with respiratory secretions, for example, or from contaminated objects. What can parents do if their child has a cold? The first recommendation is to rest. Children who are unable to carry out their daily activities, who are too tired or unwell, should stay home from daycare or from school. We encourage children to drink a lot of liquids. We also encourage them to perform respiratory etiquette. Respiratory etiquette is a series of measures to prevent spreading the germs, spreading the virus, and it involves 3 different steps. The first step is to contain secretions. So we encourage anybody who's going to sneeze or cough, if they have a Kleenex, to cough or sneeze in the Kleenex. If they don't have Kleenex, we encourage them to cough or sneeze in the elbow. We no longer recommend that you cover your nose and mouth with your hands when coughing or sneezing, because these hands will then handle surfaces that are likely to be touched by other uninfected persons. The second step in respiratory etiquette involves helping a child blow their nose, or blowing our own nose when we have a cold. And it involves using a sufficient quantity of Kleenex to avoid having direct contact with the respiratory secretions. It involves gentle nose blowing by obstructing one nostril at one time, and it involves throwing the Kleenex into the garbage as soon as we're done with nose blowing. And the third step in respiratory etiquette involves washing your hands. Hands should be washed anytime after helping a child to blow their nose, or blowing our own nose, or anytime we have touched contaminated surfaces. We should wash our hands with soap and water, and if that is not available, then it's recommended to use the alcohol-based hand rubs. If you're going to use such a product with a child, then it should be done with the supervision of an adult. The other thing that you can do when your child has a cold is to make sure that surfaces that are frequently touched by different members of the family are cleaned and disinfected. These involve a doorknob, a computer keyboard, a TV remote control, for example. So in summary, a cold can be caused by different viruses. These are transmitted by droplets and by contact. When your child does have a cold, we recommend that they rest, that they drink a lot of liquids, and that you teach them to use respiratory etiquette, containing your secretions, cough or sneeze in your elbow, blow your nose, get rid of your Kleenex, and wash your hands. And lastly, to clean and disinfect the surfaces of your home that are frequently touched by different members of the family.